I'm Stevie Monk and this is my EJB Oski. Okay, so in preparation I've got all my gear ready. So I've got my sharps container here, some swabs in case I have any spillage that I need to clean up. Got my Tegaderm there, which I've just opened. I have my flush, which has been drug checked. My lure. I have a 14 gauge needle, which is attached to a 5 ml syringe with about 2 to 3 ml of fluid in there, which has also been drug checked. Now, having that 2 to 3 ml of fluid in there is just to stop the risk of an air embolism going into the vein. And I just have my alcohol swab there too to clean the site. So first thing I need to do is explain the procedure to my patient and gain consent, just making sure he knows the risks involved. Okay, so what we need to do today is put a needle into your jugular vein just here, okay? We've tried all your other veins and they've been unsuccessful, and we really do need to get some fluids into you today, okay? Are you happy for us to go ahead? Excellent, thank you. So I'm going to position the patient's head to the side first of all. Now, there are several ways that we can get the jugular vein to distend. If the patient is conscious, we can get them to lift their legs. We can push down a little bit on the right side here, or we can get them to bear down. But today, I will just be putting some pressure or tamponading the supraclavicular just here. And I can see there that that makes the jugular vein distend quite nicely. So first of all, I'll just clean the site. Now I'm going to go into the top third of this area, and that's just so that there's no risk of going into the lungs and causing a pneumothorax. I'm also very careful with how I put the needle in, because we don't want some plastic breaking off causing a plastic embolism. So that area is nice and clean now, just waiting for it to dry off. John, we're just going to have a bit of a sharp scratch in your neck shortly. I just need you to try and keep nice and still for me, okay? Just looking again in that top third. Sharps are out. Tamponading that supraventricular, and then placing the needle. Now drawing back and checking for flashback, which I have, that's wonderful. And now flatten the needle, push it in another 3 ml. Now move down and advance the catheter into the vein. That's in there nicely. And now I need to occlude this vein before I pull the needle out so there's not blood everywhere. So occluding here. Pulling the needle out and straight into the sharps. Now attach this one, and then we're free there. We're now just going to secure that line by placing a bit of tape across there, but I'm just making sure that I can still see the insertion site, so I can look for any redness or things going on that are unfavourable. Now use my flush to check that that line is patent. This has been drug checked. So just popping that on there and flushing through. That's nice and patent. And I can also see that there's no bulge forming. So we're not infiltrating into the tissue, so that's lovely. And finish now, securing that line. I'm just going to note the time and date that I've put this line in.